Hello, my name is Mei Kwong, and I'm the Executive Director at the Center for Connected Health Policy. CCHP is the National Telehealth Policy Resource Center. We work with the other 13 telehealth resource centers, or TRCs, and provide them with technical assistance whenever telehealth policy questions come up that they can't answer. The TRCs are a group of federally funded organizations that provide technical assistance on the program and operational level to entities who are interested in starting a telehealth program or currently have one. We also provide this type of assistance to everyone from congressional members, state legislators, health plans, hospitals, clinics, providers, and consumers and their representatives. The Telehealth Technology Assessment Center, or TTAC, the federally designated telehealth resource center on technology, has invited us to talk about a very important federal agency that impacts telehealth, the Food and Drug Administration, or the FDA. The FDA has a broad regulatory scope, but one area they do regulate is medical devices. The FDA also looks at cybersecurity for medical devices and interoperability. All of these subject areas impact telehealth in some way. Before a medical device can be sold in the United States, it must be first approved by the FDA. To get approval, the applicant must submit sufficient evidence that the device is reasonably safe to use and effective. Once approved, the device will also be regularly monitored to ensure that it continues to be safe and effective. What is sometimes confusing for some in the telehealth field is whether a piece of equipment that has not historically been used as a medical device, such as a digital camera, becomes a medical device now that the provider is using it to provide services via telehealth. One of the first steps for the FDA to determine if something is a medical device is asking what is its intended use. What is the general purpose? If you are using a camera that was created and marketed to take pictures and the manufacturer never intended it to be used for a medical device, it would not have to be registered with the FDA as a medical device. But the manufacturer built a high-resolution camera for the purpose of using it in diagnosing patients, it would be considered a medical device. Another area the FDA has been active is MHealth, or mobile health. Regulation of mobile apps, depending on what it is used for, could also be under the purview of the Federal Trade Commission or the Office of Civil Rights, particularly in regards to the app collecting consumer information. The FDA has guidance on device software functions and mobile medical applications. It was issued in 2013 and has been updated in 2015 and 2019. The guidance details the FDA's oversight of device software functions, including mobile medical apps. Keep in mind that this is only a guidance and are not actual regulations. While the guidance provides insight into the FDA's thinking how it would approach regulating an app, it is not as binding as it would have been had it been an actual law or regulation. One incredible research available to you is the Telehealth Technology Assessment Center, who provides toolkits that allow users to learn the fundamentals of how various technologies work, as well as how to assess them for the use in your telehealth program. TTAC is also available to field your questions on telehealth technologies as well. However, as with all the TRCs, they cannot tell you which product is better than the other, but they can give you the tools for you to decide what would work best for your telehealth program. You can find TTAC at telehealthtechnology.org. You can find CCHP at cchpca.org. You can find any telehealth resource center through the National Consortium of Telehealth Resource Centers at telehealthresearchcenter.org. Thank you and have a great day.